minutes.
Thank you very much, Madam Chair. Earlier, I made a point of order relating to House Resolution 965 and regulations promulgated by the chairman of the House Rules Committee in accordance with that resolution. While I don't care for House Resolution 965, it is important that we strictly follow the letter of the resolution and the regulations promulgated thereunder. Today's hearing or proceeding is not the problem. These witnesses are honest. The problem is that the regulations the rules chair promulgated are at best clumsy. If we have a witness in the future who intentionally misleads this subcommittee on a material fact, i.e. perjures themselves, as an attorney, I am confident any attorney worth their salt would successfully defend and have their bad actor found not guilty of misleading us or perjuring himself. I implore the majority to reread the sections I mentioned and rewrite the regulations. Don't read the resolution and the regulations for what you meant them to say. Read them for what they actually say. Thank you, and I'm now going to go to questions. Governor Hutchinson, in a paper released by committee Republicans on testing and surveillance, we recommended that a top priority should be testing nursing home and assisted living residents and staff, whether symptomatic or not. Nursing homes and other congregate living centers account for more than 40% of the COVID-19 deaths nationally, even though residents at these facilities represent a fraction of a percentage of the population. It is my understanding that you have made a pledge to test all nursing home residents and workers starting this month. Can you explain this initiative and how it fits into your overall testing strategy?
Well, thank you, and I appreciate the committee report that emphasized the importance of this. And the reason we're doing it in Arkansas is that, of course, this is the most vulnerable population. We want to be able to keep them safe, and with the staff going in and out of facilities as necessary, we want them tested whether they're symptomatic or asymptomatic. So that's a critical part of it. It also will identify uh, any residents that are positive, that we can isolate them and take the protective measures. I think it'll be a great boon. And what we ultimately want to get to is that we can once again have people tested to go in and visit a family member. We've got to be able to stop having total isolation of someone in a nursing home and to let them come back to be around their loved ones again. And hopefully, through this testing process, we'll eventually be able to get there.
Well, and I appreciate that. I know somebody whose loved one was in a nursing home, had some dementia, would not, without their family there to encourage them, would not do their therapy. And then subsequently, within a week or so, died after they contacted me about the problem about getting in to encourage them to do their therapy. So I know that that's important. Has the state established protocols for if a resident or employee tests positive in order to prevent an outbreak? And if so, what protocols do you have at this point?
Well, of course, if an employee tests positive, then they are isolated, they're quarantined, and there's been a question as to whether a staff person who tests positive should be able even to treat and work with positive patients. And early on, with desperation, I think that was done in some isolated cases, but we've got sufficient resources now that should not be done. That's not the ideal. So they're simply isolated and given, of course, the health benefits, and they should be paid during that time. Every worker who tests positive should not have an obstacle and say, I'm not going to get tested because I might lose 14 days of wages. And that's something that we need to continue to do.
Well, that's a really good point, and I appreciate that. As a note on some prior testimony, I would point out that the Defense Procurement Act was in fact used to give funds to Puritan Medical Products in Maine, and they are increasing their swab production by 20 million. So they're doubling it from 20 to 40 million. I think that's important. Would you agree with that, Governor?
Absolutely. I mean, the Defense Production Act has been utilized for the supply chain, and that's been appropriate. And it's been quietly influenced by the federal government as well as to where the hotspots are, where the priorities are. And I would say that they're used the Defense Production Act in terms of the supply chain for food, for poultry, for meat. That is essential. We cannot go to our grocery stores in this environment, in this America, and not have sufficient food for people who need that nourishment. And so the supply chain, I'm glad that the president invoked it for that purpose.
And I agree and yield back.
I thank the gentleman. Chair now recognizes